So it drops down to below its normal intracellular and increase in hydrogen ion concentration, so it becomes more acidic. So one of the other effects that I wanted to is not pumped inside the cell, so what we end up is an increase in hydrogen ion concentration, so it becomes more acidic. So one of the other effects that I wanted to complex or immortality complex in which they, nothing will hurt them, so they just stop taking their insulin, and then within a day or two they go into DKA. So what happens is, without insulin, our cells can't, if we don't have insulin, then our glucose transporters can't let glucose in. So the glucose is, we have plenty of glucose in the bloodstream, but it can't get into the cells, right? So if it can't get into the cells, two things happen. One thing is the glucose outside of the cell becomes very, very high, so we have elevated BGs. And then the other thing is there's no glucose in the cells, so the cells have to shift to other substrates for energy production. In particular, they have to shift to using proteins and lipids. Now when they do that, our bodies can work fine with just proteins and lipids, but when we use a lot of proteins and lipids in our body, one of the byproducts of metabolism of proteins and lipids is ketone bodies, or keto acid. This person's blood glucose level, random check, it would be normal. Early on in the disease, if you checked a glucose load, it would still be normal, because the beta cells are able to compensate by cranking out extra insulin. But what happens is, after years and years, literally, anemia. Now, with hyperinsulinemia, cranking up these beta cells, and what happens is these beta cells, for a while, function just fine and cranking up these beta cells. And what happens is these beta cells, for a while, function just fine and crank up insulin resistance. And, I think we're starting to understand this disease a lot better, but we still don't understand it completely, what causes insulin resistance. So with type 2 diabetes,